Welcome to Promoting Healthy Vision for the Baby Boomer Generation, Identifying Problems, Preventative Measures, and Treatments. The whole of life lies in the verb seeing. Visual impairment is a very common circumstance of aging. As our eyes naturally age, our vision is at risk for an array of ailments. Under the best scenarios, the visual changes are correctable. Under the worst scenarios, vision can be completely lost. The aging eye is a significant concern in our society. Baby boomers, individuals born between the years 1946 and 1964, have created a substantial demographic shift. This group consists of approximately 78 million people. They are becoming the new old. This significant increase in an older population will in turn create increased vision care needs. Although aging is an inevitable process, we can take practical preventative measures to avoid age-related eye conditions, or at the very least ensure early detection and treatment to prevent vision loss and blindness. What are the age-related visual conditions? Presbyopia. This all-too-common condition often begins to occur by the age of 40. The primary symptom is the inability to focus on near objects. This occurs as the aging lens loses its flexibility to change shape and allow the eyes to focus. Dry eyes. Aging causes a decrease in tear production, leading to dry eyes. Symptoms include stinging and discomfort, light sensitivity, heavy eyelids, red eyes, and blurred vision. Reduced tear production is particularly common for postmenopausal women. Reduced pupil size. As the muscles that control pupil size age and lose strength, the pupil of the eye diminishes in size. The smaller pupil permits less light to enter the eye. Thus, the older individual will require more lighting to see well. Adaptation to the dark is also diminished as the pupil is slower to dilate. This will cause extreme glare when emerging from a dimly lit space to a bright sunlight. Diminished peripheral vision. An individual's visual field will decrease approximately 1 to 3 degrees for every decade of life. This would amount to a 20 to 30 degree loss in the peripheral field by 70 to 80 years of age. Decreased color vision. With aging, cone cells responsible for our color vision decline in sensitivity. Therefore, colors have a tendency to be less vivid and bright and appear somewhat faded. Decreased color vision also results in a loss of contrast sensitivity, which makes it more difficult to discern objects. Thus, sharper contrast is needed. Sensitivity to glare. The clouding of the natural lens scatters light entering the eye, which causes a heightened sensitivity to light and glare. Floaters. These spots occur from an age-related condition, vitreous detachment. This occurs when the eye's gelatinous interior liquefies and separates from the retina. Despite all the conditions related to the aging eye, normal vision can be achieved and maintained with the use of corrective lenses. This example photo and grid illustrate normal vision. What are the age-related eye diseases? These include cataract, glaucoma, and macular degeneration. Cataract is the most common age-related eye disease. As the natural lens ages, it becomes harder and denser due to the buildup of high-density protein fibers. This causes the lens to become cloudy, causing a general blur and often a heightened sensitivity to glare. The process is so slow and gradual that people are usually unaware of any visual loss in the early stages of the condition. Fortunately, cataract is the most common cause of reversible vision loss. Normal vision can be restored with an outpatient surgical procedure, phacoemulsification. Glaucoma is also known as the silent thief of sight, for there are usually no symptoms or signs until the condition is advanced and there is irreversibly diminished vision. The damage occurs when the fluid pressure in the eye becomes higher than the normal range, eliciting damage to the optic nerve, causing a reduction in peripheral vision. It is estimated that approximately half of all glaucoma cases remain undiagnosed, and many that are diagnosed were detected incidentally following a routine eye exam. Although there is no cure for this condition, there are treatment regimens that can prevent or slow vision loss. Age-related macular degeneration, ARMD. is the most prevalent cause of legal blindness in Americans greater than 60 years of age. ARMD affects the macula, a small part of the retina, which allows for sharp, clear central vision. As ARMD progresses, individuals develop blurred and distorted vision. This may eventually lead to the development of a blind spot in the central field of vision. ARMD is one of the most devastating and debilitating visual disorders in the aging population. Eye disease risk factors for glaucoma, cataract, and ARMD are: the most prominent are age and family history. Other factors include race, past history of eye inflammation or injury, smoking, excessive exposure to UV sunlight, diabetes, hypertension, and high cholesterol. Baby boomers in their 40s are prone to presbyopia, dry eye, and computer vision syndrome. It is recommended that they have a routine eye exam at least every 2 to 4 years and use corrective lenses. Baby boomers in their 50s, the presbyopia worsens and dry eye increases, especially in postmenopausal women. They are now at an increased risk for cataract, glaucoma, and macular degeneration. Recommended eye exams every 2 to 4 years and wearing corrective lenses. Baby boomers in their 60s have decreased ability to see in low light, and they may have more spots and floaters. Risks are increased for cataract, glaucoma, and macular degeneration. Recommended eye exams every 1 to 2 years after the age of 65 and wear corrective lenses. Practical preventative measures can safeguard against devastating visual impairment. Know your family history and other potential risk factors. Have routine eye exams to detect early disease. Seek prompt screening for any sudden visual changes and emergency eye symptoms. Have regular physical exams to manage existing medical conditions such as hypertension and or diabetes. Minimize exposure to harmful ultraviolet sunlight. Wear protective eyewear when performing tasks that pose the potential for eye injury. Cease smoking and maintain a healthy lifestyle with a balanced diet and exercise. Healthy vision will help you maintain a productive lifestyle. Healthy vision will enhance leisure activities. Just looking at you